Welcome back to Shape of the City. October is Breast Cancer Awareness Month. While mortality rates appear to have declined in the last decade, the incidence has not. Joining me to talk about what we should all know about breast cancer are Tamara Robinson from the American Cancer Society and Dr. Derrick Anderson from People's Health Center. Thank you both for joining me.
You're welcome.
Well, now let's start with Tamara. Let's get some statistics.
Okay.
What are we currently looking at for cases and deaths from breast cancer in the United States?
So for breast cancer in the United States in 2015, they said we have an estimated 231,840 new cases of invasive breast cancer will be diagnosed in U.S. women, as well as an estimated 60,290 in situ cases, so that's when it's kind of pre-breast cancer. And then also that year we're expecting about 40,000 women are expected to die, which only lung cancer accounts for more deaths than breast cancer in the U.S.
Okay. Now, what are some of the biggest risk factors for breast cancer?
For breast cancer, the biggest things are age. So as you get older, your risk increases. If you have a personal family history of breast cancer, puts you more at risk. Genetic traits, so a lot of people have heard about BRCA1 and 2, the whole Angelina Jolie effect. People have heard about those. Some forms of benign breast disease out there can cause that. If you have either earlier menstruation or late menopause, kind of on both ends of that. And then if you've never had children or having your first child after the age of 30, those things can also be risk factors.
Okay, very interesting. Now, who's most at risk for breast cancer? Dr. Anderson, tell us more about the disparity for breast cancer mortality rates for African American women as well.
Well, the people that are at most risk are the ones that have a family history, and so if you have a mom or an aunt or a sister that has had breast cancer, your risk goes up. Obviously, if you're not getting the screenings that we would like you to do, your risk goes up because you're missing those lumps, those bumps that may be abnormal and need to be checked.
Okay. And now for African American women, how does that differ?
I think the most important part of that is that they're not getting those screenings done, so they're not going to the physicians with the lumps and the concerns and doing the simple mammograms or ultrasounds even that can check out some of those concerns. So if they don't go, they're not being screened and we're not finding those cancers.
Okay, very good. Now, what are the different types of breast cancer?
Well, as far as types, that is determined by the pathology, which is a small part of that. Cancer will be taken and they can assess what cells are making up that cancer. And then we also look at whether it's in the breast by itself or has it spread outside of the breast. Those are the characteristics that make up the different cancers.
Okay. What are the keys to breast cancer survival? Excuse me.
Well, number one, being hopeful. Number two, the rates of mortality are going down, but that's because of the screenings going up. And so if you're found early, then your chances and odds are better. And so my mother-in-law, to be on a personal note, she was 45 when her breast cancer was found, and she's 74. So there's that hope that you could live for 30 or more years with, having had breast cancer.
Okay. What do you think is the biggest factor affecting more women coming in for screenings?
I think this just simple education, getting out and doing talks in the community make the most difference, because if we're not spreading that information and that knowledge to our communities, they're not coming in. And so as access to healthcare improves, those patients will get that message over and over again, whether it's for a sore throat or if it's really for their physical. We can talk about screenings.
Very good. What message would you give someone who has recently been diagnosed or has a friend or family who's recently diagnosed?
I would say that there are many resources, after that first diagnosis is made, as far as cancer navigators, which will help you through the process. There's resources online and small groups that you can lean on. So although it might be a longer process as far as treatment, there are those resources that they can use.
Now, what are some of the barriers to coming in and being screened?
So I think for some women, some of the barriers really are that culturally, we're talking about, a really sensitive subject, and, for them it's kind of a taboo thing to talk about your breast. I mean, that's a personal thing. So for them to come in their culture, and I think, even just as women in general, that's kind of hard. And I think also is just a fear of really finding out and knowing. Sometimes they're just like, I just don't want to know. So that people just don't get it done. Or maybe just even a lack of knowledge. We find that a lot. We do education so much, but there's still, I think, people that they really don't know all the facts or know when they should be screened.
And culturally, there are some barriers to males doing breast exams, and some women don't feel comfortable in general with a male doing the breast exam. What I usually tell them is that someone needs to know their breasts, and so if they don't know their breasts, we can't pick out those abnormalities that are concerning. And so we do offer them women providers that can do those exams on their behalf. On my behalf, essentially. If they're my patient, I will refer them to one of my female providers.
Now, Tamara, what can viewers do to help make a difference and help fight against breast cancer?
So the American Cancer Society has had a long history of research and funding, and a lot of, I don't know if most people know that we are actually the second largest funder of breast cancer research in the U.S., right after the National Cancer Institute. So a lot of our funding goes to just research of how actually curing this and preventing it from ever happening. So different, working with the American Cancer Society, we also have a lot of programs out there and support services for patients. We have a program, it's called Reach to Recovery, that is for if you are a breast cancer survivor and you want to give back and help those who have been diagnosed, new survivors, to really reach out to them. And we also have a walk that we do every year, the Making Strides Against Breast Cancer Walk, which is going to happen in Lincoln this year on October 23rd, so people can come out and support. And then the new program we have this year we're doing is the Real Men Wear Pink campaign. So we called on community and businessmen in the different communities. So in Lincoln we have 24 men who have come on board to fundraise and wear an article of pink every day for the month of October. And actually Dr. Anderson is one of our Real Men Wear Pink. And then also, kind of in conjunction with our Making Strides walk.
Very good. Well, thank you both for joining me today and teaching us more about this fight against breast cancer.
Thank you.
You're welcome.
When we return, we're going to learn more about an organization helping girls through running.